available today. So we have a number of facilitators here today mixed into the group, and perhaps people can wave just briefly. So Sidi is our subject matter expert today. Sidi is online already. And then we have Tan Van Le from Vietnam joining as a facilitator. Van was an earlier leadership program participant a few cycles ago and has now signed up to be a facilitator. Then we have Jane. She sent her apologies, so she cannot be here today as a facilitator. She will join us again for the next session. And then there's Elizabeth. Can you wave? So a colleague of mine, Elizabeth Anderson, will also run one of the breakout rooms. Then it would be helpful also if people, the Spanish speaking people, could just give us a wave, because in the past two discussion sessions we had a small number only of people who are preferring to speak Spanish in the discussion session. So any wavings here? So I'm trying to look at both screens, because what we're planning today, we will have a mixed group of Spanish speakers and English speakers, and then try to facilitate this within the group to have a broader discussion base for the within the individual groups, because the last two sessions, the Spanish speaking groups were very small. So that's it really from an organizational perspective. I can see some of you already added their countries. So if you could please do so, so that when you have the discussions, it's helpful that others can see where you are located. I can see most of you have added their countries. There's someone. I can see user. I don't know, sometimes it's tricky to change the name, but if you can and you have the feature, please do so so that other colleagues know where you're located. And then looking into the topic of advocacy and change. You will all have seen the videos and the information on the website. There was a comprehensive presentation by our past CEO, Jonathan Kruger, and then also a presentation and a short interview from Scott Willis, the past Australian Physiotherapy Association president. So, are there any questions from your side on the material on the website? Varies. Then I think what we should do, head straight into the first discussion session. You will all have seen the outline that we have for today's session. There's three discussions that we're planning, all on advocacy and change, which is quite a complex topic. So this is why I decided to split it into three discussions. And the first one will focus on the context of any projects that you were involved in or you are planning to do. Context is a big factor of your success of any advocacy and change projects. So this would be great if you could focus the next 15 minutes on this aspect. We will distribute the groups and we will have Sidi, Beth, Van, and myself leading the individual groups. Also, as a reminder, the facilitators, could you please identify someone in your group who is taking notes or really capturing the main points that are being discussed in your group for the summary that we will have in the plenum when we come back, because for the recording we cannot have recordings of the individual small groups. So for really to make sure that we capture the main points, it is important that we have a short 1 minute summary from each group, and the facilitators could please help to identify someone within the group to do so. So my question here for Gokul, are we ready to go out into the small groups?
Yes. How long are the breakout rooms?
15 minutes
Yep.
is the first one.
Yep. Just a second. I'll open the rooms.
Great, then see you in a moment. Suddenly cut off mid-sentence. Normally there's a warning about in 60 seconds or so you will be taken out. So it was a bit of an interesting experience, but here we are again. So I hope you had good conversations in your small groups. Let's go to the different groups. Sidi, who's reporting back from your group?
Um, we actually designated Wendy, but
Okay.
we had I don't know if it was a poor appreciation of the time or the lack of warning, so we didn't have the time to wrap up. But I'm sure Wendy could have a go. If not, I will
Great.
probably step in
Yes.
to add a bit more. But sorry for those who didn't have the opportunity to speak.
Yeah, I think what we'll do, we'll stay in the same groups, Gokul, um, as we are a big group and a bit short on facilitators today. So we will keep the same groups so that we do not have this kind of, yeah, introductions in the beginning. So we will stay in the same group. So Wendy, do you want to share the summary of your conversations?
Yeah, we had a real range. Basically, we said context is setting the scene, defining the priorities without having that good understanding. Um, we need that to ensure effectiveness of our advocacy strategy, so it's intricately linked. Some of the key themes were changing elections. So in Slovenia, that was a big contextual environment, as that currently there is an opportunity with having the government wanting to have a good news story of health. So they're exploiting that currently. Other things was in other countries just a lack of understanding of the physiotherapy profession. So some groups exploiting that and yeah, like trying to increase that knowledge. So it's much more difficult, the context. The other one is a lot of social and political change within some of the countries, such as Ecuador. So there's not as many memberships, and again, having to work really hard in that area. And the last was more smaller membership again and not being independent. So the physiotherapy being joined to the medical association. Um, from my perspective in New Zealand, we're the same. We're having a new government change, and they're quite, again, it's quite different. So that's going to be changing, and we're noticing the economic climate as well,
Mhm.
with yeah, is changing the context. So that's a summary. Not sure if there's
Thank you,
anything
Wendy.
more to
I
add.
think this is a recurring theme with changing the government, which can be an opportunity, but can also be, can be a context that changes in both directions. This also came up in our group. Thanks for sharing the high level summary from your group. Beth, from your group, who's feeding back?
Hi, yeah, so Kim is going to feedback for our group. We had multiple discussions, and yeah, unfortunately, we
Yes.
didn't get to catch Alexander at the end, but we will add
Yeah,
what
we
he
will
was
stay in
saying
the same
later.
group, so we
Yeah,
will make sure
it's
that
fine.
others also have a
But
chance to
yeah,
share their perspective. So,
Kim
Kim,
will
can you
share.
please go ahead?
Thank you.
We,
Discussions, we were talking about how things were successful, but one of the main kind of threads was the political aspect. And in Sweden, they were talking about how they had a very close relationship with the politicians and a really strong foundation of what physiotherapy is. So they weren't having to start from scratch each time talking about it. In Ireland as well, they were trying to do some campaigns, which have been successful, but they're slowly working through. And one of the campaigns was trying to get radiology from physiotherapists being able to prescribe that. So kind of understanding how you have to, at each time for the political aspect, how you have to advocate for the physiotherapy side of things, but not starting from scratch. And I think from where I am in Bermuda, that was one thing that was maybe not successful with the campaigns that we did here, was not incorporating that aspect as much. So even though we did maybe the community aspect and pushing for the information and education, that side was not actually how we could make the larger change from the political side. And that's kind of where we got to. Anything else you want to add there?
Thank you. So Van, from your group, who is reporting back?
From my group, Ahmed will represent one of them.
Yes, Ahmed, please go ahead.
Yeah, thank you. So in our group, we have discussed about many issues which are very important for the profession. So like a referral system and the gaps between leaders and the workforce, and in development and establishment of preventative care, like in Singapore. Overall, what the issue of having this new development, we need to understand the bigger picture, the context of the issues. So all the political issues behind from different governments, different associations, different professional bodies that actually are involved. And also we need to understand the smaller picture, how the process is working within the country, because there are some variation between country and another country. So that's all from our side.
Great. Thank you, Ahmed. And then from our group, Marcela will feedback. Please, over to you, Marcela.
Hello. We discuss in our group the experience of development of physical therapy in South Africa, United Arab Emirates, and Chile. We discuss the context in terms of legal, political, economic, social, and technological issues in probably campaigns. The main point is economic, maybe for the implementation and possibilities of regarding the point I have mentioned. We saw the context of South Africa about 4 and 5 years perspective of practice about payment and cost of physical therapy. They have expensive task, and in United Arab Emirates, physical activity as a promotion across lifespan policy advice is a point of developed with guidelines to promote physical activity and prevention of non-communicable disease, and the context of Chile about direct access, despite there is not recognition yet of physical therapy like medicine, nursing, dentistry, and midwifery. Direct access is a good point to share with the authorities in a way of recommendations.
Great. Thank you, Marcela. So really summing up from what we've heard from all the groups, there's a lot of political context that you were referring to, and then also resources-wise. So how many members are supporting your project, on how big is the group that is really driving the advocacy and change project. So really the lack or availability of resources also makes a big difference. So before going into the next group, I would like to give the word to Sidi. Sidi, have you got a few thoughts from what you've heard in your discussion, or anything else that you would like to add on advocacy and change and context?
Thank you, Birgit. It is very clear that across the different countries or the membership of World Physio, it's definitely not a one-size-fits-all. It changes from one country to another or from one region to another, but yet there is a lot of similarities across the board whether it is with regard to the political context changing, whether it is about the inclusion or the recognition of the profession within the health sector, whether it is about regulation, like physios having a proper control of who is allowed or not to deliver physio services, the relationship between physios as an independent profession and the rest of the medical community. I think this is across the board now at different stages, of course, one of or some of the challenges the profession is facing across the board. And it is quite interesting that this has been in different way reflected in the initial discussion. And I'm sure when we go back to the breakout session and start talking about expected outcome, we'll find a lot more similarities also. Thank you.
Sorry,
Your
I've been
microphone
talking
is
to
closed.
myself. So I think we're ready for the second group. I was just suggesting to Gokul to also keep this to 15 minutes so that we've got a bit more time on overall reflection. And this second breakout is focusing on the outcome of any projects, what you're aiming for. And sometimes the challenge is to be as specific as possible in describing your outcome and really, yeah, perhaps have it in different phases or in different steps on how you would like to go about on the outcome of your advocacy and change project. Gokul, are we ready to go into the breakout rooms?
Yes.
Super. Thank you. On.
Yes.
Can we start with your group one? Who's
Yes.
reporting back?
Stig will report the outcome of the discussion. Yeah, please. Stig, can you share the outcome? Yeah, thank you.
Can you hear me now?
Yes, Stig, we
Yes.
can hear you.
Yeah, thank you. We talked a little bit about the different things that was important to the different organizations, and we talked about referral rights because in Norway we want referral rights. We already have direct access, and we feel that the next step is to have referral rights, and that is because we feel that it's going to be a more efficient system for the patients, and it's also going to get the waiting lists in the health system down. And should I talk about how we did it, or how we've been working on it?
So I think it's about what other aspects that were brought up under the item of outcomes of different projects within your small group. Did you have any other examples of outcomes on how they were defined?
What did you mean by the question? Also, my English is not that good, so.
No worries. So in your small group,
Yes.
you hopefully had various people sharing
Yes, we
their
did.
outcomes. Are there any other outcomes from other colleagues
Yes.
that you
Yes, there
can
is.
share with us?
Yes, there is. It's we have one that talked about how we as physios can help with the needs of the society with an elderly population, and also how when we have to work different professions together, how we can keep our physios identity. And also we talked about competency and what the skills you need to have as a physio.
Okay, so one of the projects was to identify the skills and competences of physiotherapists.
Yes.
Great. Thank you, Stig. Then let's go to Beth, to your group. Who's reporting back from your group? What were the outcomes of projects, advocacy and change projects that were shared?
So I think Kim's going to report back again. Kim's really taken that leading role in her first time here.
Yes. So for the next group, it would be helpful to have
we'll have someone else.
Pass it around.
But
Thank
this
you.
time it's Kim.
Let's go to Kim for now.
You.
Thank you.
About increasing awareness. So when we were talking about the campaigns, a lot of the goals were increasing awareness to the public and to the political ministers and things like that. So we're talking about whether we did surveys or one of the things that Gillian said in Ireland, they talk about how many times physiotherapy was mentioned in the media or social media, and kind of using those clippings and articles to kind of see how successful it was as kind of the awareness and of how much it was being advocated for. And one of the other things we're talking about is the larger context of how long these campaigns take. So sometimes splitting the goals up into shorter lengths to kind of see how successful it is being. And when we're talking about the larger things of advocating for protecting a title, that's going to take much longer than the shorter campaigns that maybe we're talking about education for the public. So how do we kind of set those goals? And I think it was really hard because when we talk about increasing awareness, sometimes that's harder to kind of see as a particular goal. So that was one thing we were saying, how can we do it, is how many times maybe people are accessing services, referrals, our waiting list going down, how many times have they emailed the service asking questions about physiotherapy, and how we can kind of do it that way. So I think that was quite hard because we wanted to say, even though with the context is different from each side, how can we actually measure increasing awareness for the public and their campaign as an objective sort of measurement? And I think those are the things we came up with: the surveys, email, more questions, how many times it's kind of presented in the media and social media and articles about physiotherapy.
Great. Thank you, Kim. Sidi, from your group, who's feeding back on the outcome discussion?
I think it will be Wendy again because she was so effective. And yeah, Wendy, the floor is yours.
Thank you, Wendy. Please go ahead.
Yeah, very similar themes to what's already been reported. So we spoke about regulation, so defining those essential skills sets to practice. Specialization was another one, so more defining, having that recognized as musculo, peds, neuro, etc. Within the Ministry of Health. We also had recognised referral rights as well. So like within New Zealand, we're looking at having the right to do medical certificates rather than just GPs, that patients can come to us. And also within the public sector that we have got the recognised for specialised appointments for the orthopaedic pathway, which is really hard, but working on that. Also other areas more, having that first contact right rather than being linked with medicine, and also the actual association being separate from the medical board as well, to improve the recognition of the profession within both the public and also at a political level as well. I'm not sure if I've missed anything there.
Thank you, Wendy. I think that's really helpful. Let's go to our group, and Monique is feeding back, and then let's go back to Sidi on final thoughts on this aspect. Monique, please go ahead.
Thanks, Birgit. So we had feedback from Rwanda, Kosovo, and Zimbabwe, where all three were working on integration within primary healthcare. Rwanda has quite a short period of time, which they're wanting to implement in 3 months for improved pathways. So they went around training interdisciplinary teams, so doctors, nurses, and to see how they can have improved referral pathways within the primary healthcare setting within Rwanda. In Kosovo, they involved the Minister of Health and other stakeholders to also start doing sort of education around what physiotherapy actually does and how to integrate that into primary healthcare. In Zimbabwe, we have an issue where there is not enough jobs. And the way the PT Association over there looked at it is if we improve primary healthcare, it ultimately means more jobs for the physios out in Zimbabwe. Within Saudi, they were looking at a practice change with residency programs, and they are now in the next phase of their advocacy campaign, where they are looking at convincing policymakers to have a role out throughout the country. And then in South Africa, we had the legal challenge. So we are ultimately wanting the way funders are funding and being able to claw back money after paying for services to change, so that the funders are no longer going to be the judge, jury, and executor in the audit processes.
Great, thank you, Monique. This was a very succinct, very good overview of the comprehensive discussions that we had. Thank you, Monique.
Thank you.
Sidi, any thoughts on outcomes and any advice perhaps that you have for our leadership program participants?
I mean, here again, we can just read through the different exchanges we have, the different stages where the profession is in the different countries. In some countries, it's about awareness raising, letting people know about what the physiotherapy is able to do and should be doing. Whereas in other settings, we're talking about specialization, which will be leading to physios being the first professional contact. That would also go along with the regulation aspect that goes to it. And if you look at it from a timeline, then you will see how each one of them are connected. You will never be able to achieve specialization if both public and decision makers are unaware of what the scope of practice is for the professional in itself. The profession cannot expand as a medical field or a scientific field unless the physios are able to further their skill and specialize themselves into specific areas. And that's what will increase the production of good quality research, because it will be done by professionals who have the skill set that is needed, because specialize in some specific field. And if you put it into the regulatory context, it makes a whole heap of sense. So you can see how you're moving from raising awareness within the profession, raising awareness at a larger scales, involving decision makers, and how also that would affect the quality of services, the education system, because all of that are very well interlinked. And this, in some way, if you're following the trend we're taking to, that's just give you a good understanding of how important advocacy is in the work we're doing. Because until people know what you're able to do, they will never give you the opportunity to do so. So advocacy is what allows you to know what you need to get and what you're going to do with those set of skills. It's not about asking to be the primary contact or direct access, but also for you to be fully aware of what actually you need to have as a professional to be able to get to that specific level. And this also will help us a lot in the next session about defining the strategies as to, yeah, this is what I want, but how on earth will I be moving from where I am to where I want to be?
Yes, thank you, Sidi. So this was already a great transition into the next discussion. When looking into the strategies, you also mentioned research underpinning your argumentation and the points that you would want to make with the decision makers. So for this last discussion group, we have another 15 minutes. We'll stay in the same groups, and you think about strategies that you have applied or you are applying or planning to apply to get to your outcome. And again, please have someone reporting back, a new person, because this is also part of the leadership experience, that different people, also non-native English speakers, have an opportunity to share and share the summary with the bigger group. So Gokul, are we ready to go out into the small groups?
Yes.
Super, thank you. For this, welcome back all for this last summary of this discussion session. So let's go, Beth, let's go to your group first. Who's reporting back?
Yeah, thanks so much, Birgit. Alexander is going to report back for our group
Okay,
this
Alexander, please
time.
go
Yeah.
ahead.
We discussed example of a strategy from Sweden where they try to regulate the education for a PT specialist. And then in the discussion, we discuss different roles of aspects such as good statistic, good data, good research, that it is crucial to present how you can save money as a profession, as physiotherapy, because the politicians often think in economic paths, and as well as how we can save money, but as well have high standards in our treatment, how we can provide good health care as well. And then we discussed the role of participation in campaigns and support from other groups such as other health professions, nurses, doctors, physicians, and so on. And that there are a lot of benefits if we involve and also raise awareness in those groups who work with us and perhaps have a better standing in our country, especially when we as physiotherapists are a small group in our country. This is very helpful for us. And at the end, we discussed the connection of our campaign with other events or other campaigns, such as the sustainable goals of the WHO or the World PT Day. So events where we can increase the outcome of our campaign, of our strategy.
Super, thank you. So the liaison also is an important point on where you can perhaps find other groups that have similar goals to yours. Thank you, Alexander, for sharing your summary. Van, from your group, who's feeding back?
Thank you, Birgit. From our group, Clayton will report. Yeah.
Hi, okay, thank you.
Yes, please
Yeah,
go ahead.
so from our group, we found a few common themes. Even though we are reaching out to different groups of people. For myself in Singapore, we were hoping to get more people into the community care sector. And in this way, we are hoping to reach out to students through the schools. The similar strategy we use is to use the World Physiotherapy Day, because that serves as a one identity, one unity, whereby we represent our profession as to what we do. So through the World PT Day, we can actually do outreaches to the schools or to the students. And for my focus, it was to maybe get students on board to volunteer into community care organizations where they get more exposure in a less threatening way as opposed to a clinical placement, which is stressful. Whereas for Quay in Vietnam, he is hoping to reach out to students to close the gap for research capacity. And that's where they can use the World Physiotherapy Day to create like competitions for research. And that's where students can use those platforms to present what they have done so that they can be more confident and to work out the things they do. And Stick from Norway as well as Ahmad from Oman shared about the different works that they have done. And it's advocacy towards the other spectrum where it's moving up towards the top levels like ministries and governments. So for Ahmad in Oman, it is about raising competency standards. The common thing that we find between this is that it all starts off from a small focus group where the association or society would figure out how this works for everybody. And thereafter, they would actually move on to the next steps of stakeholder engagement or distribution channels such as training, workshops, and social media. So the stakeholder engagement process is long. You will not only have to engage people within the profession, but also out of the profession, as well as politicians, and move up the government levels before more approvals can be done. So it's a long process and it's bottom up.
Great. Thank you, Clayton, for your summary. So from our group, it is Regina feeding back. Regina, please go ahead.
Okay, thank you, Birgit. So we had feedback from UAE, Kosovo, South Africa, Rwanda, Chile, and Zimbabwe. And most of the strategies included public engagement, public health authorities, schools, community programs. Kosovo, they integrated media profiling, opinion articles. They also did parliamentary engagement. In South Africa, they had meetings with funders because they were trying to sort out how practitioners are paid back by the funders. So they had meetings, and when that didn't work out, they went to the legal route, and they're planning more meetings with the funders because they are viewing them as partners. And instead of fighting them, the legal battle is about the constitution. And then in Rwanda, they are engaging policymakers and interdisciplinary teams to improve awareness of the profession. In Chile, they did policy engagement, political engagement, parliamentary engagement, and ministerial briefs as they're advocating for direct access. And then here in Zimbabwe, we are going to be doing meetings with policymakers, with economists, and also using clinical evidence to try and advocate for better funding for rehabilitation programs.
Thank you,
A
Regina.
summary of
Thank you. Thank you. Sidi, your group, who is feeding back from your group?
Yanis will be reporting back.
Okay, Yanis, please go ahead.
Yes, on this topic we could probably discuss for a day, but if I wrap it up, we identified two very important outcomes on which we wanted to reflect, like on strategies which strategies we could apply for these two outcomes. These two outcomes being the awareness of the profession, and the second one being the direct access. Regarding the awareness, we were discussing on how to raise awareness of what PT is or what PTs are doing. And we were discussing that the different strategies are needed if we want to raise awareness for the general public or the communities, or for the politicians or decision makers. And we said that, or we discussed about that World PT Day is the one day that should be used and can be used as a good tool to raise the awareness. And the second one was direct access. We were discussing about how could we what are the strategies that we can follow. We could use lobbying as the one strategies to help us with this. We should prove the cost effectiveness to different stakeholders. We should form allies from the public and also different stakeholders. We should present the research about the positive effects of the direct access. We should also have medical insurances behind us. And then the education element was also raised, which we should reflect on this, how we can reduce the cost when we have the direct access if we have specialization and this education element in place. So that was it from our side.
Great. Thank you, Yanis. So first of all, I really would like to say thank you for all of you to engage in the discussions in the small groups, for the facilitators and and those who reported back from the small groups. I must say to my colleagues, I'm really very pleased to hear that in so many points the World Physiotherapy Day came up as a good toolkit to raise awareness of what physiotherapists do. So this is really worth something for us sharing within the team, and that's great to hear. So before we're concluding, Sidi, any closing remarks from your side on advocacy and change, or anything that you would like to pass on to our participants?
Thank you, Birgit. I would like to start by thanking everyone in this cohort for the very interesting discussion, and share your point also, Birgit, because from where we're sitting, with the aim and the mission to serve the profession and work with our member organization that you are representing, getting this feedback is so enriching, because not only it allows us to change what need to be changed, but also expand on some of the ideas that come out of these very interesting sessions. And I think at this stage, we all know that PTs are not only clinicians. They are also educators. They are leaders, and they are advocates for this profession. And they constitute one essential pillar in the health system delivery. But we all know that. But do the others know it? And the others are the patients we are serving, and those who are above us and making decisions, and quite often who are the least knowledgeable about what physiotherapy is about. So to bridge that gap, we all know exists. And that's one of the reasons each one of you are actually where you are. Because being in an association or taking that leadership role has nothing to do with clinics. It's because you felt that there is some work to be done in bringing the community together, in working towards addressing those gaps. That's why you are where you are right now. And that's why we are where we are right now. It's because we are very much aware of that gap. And advocacy is the only thing that allows us to move that agenda. Because until people know about what you do, there is very little chance that they will integrate it. If they are responsible for policies, you will not be part of those policies. Now, we should not be waiting until the Minister of Health or somebody that has authority at that level has a stroke. Because at that time, they realize that, yeah, this is how important physios are. But we need to be a lot more proactive, making sure people understand what is the specific and unique role physiotherapists do in the health system. And until they get to that point, it's going to be impossible. The same way we've come to realize that research is a key element in advancing the profession in that pathway of recognizing it as a scientific field, the same way also we need to work towards making sure that we raise the awareness and convince the decision makers that you cannot do policies about physiotherapy without a physiotherapist being involved in it. We cannot talk about physio education without physios being involved in it. In some countries, you do your training and you have people who are educated at the PhD level who will be responsible for the delivery of your curriculum and your education. But in most countries in the world, those who are teaching physiotherapists are not even physiotherapists. And if you look at the bread and butter issue, you realize that beyond the general public interest, it's a bread and butter issue. Why would the medical doctor let you free if you are contributing in legitimizing his authority? He will never let, it's the power struggle. Because letting you free,
a whole can of worms here.
letting you free would mean him losing some of his authority. That's an uphill battle.
Yeah.
Nothing
so this also,
nothing
I think,
is
Sidi,
given.
what you were saying, this also leads into the next discussion. It's about strategic planning, and I really want to excite you about that one. And Sid, you will be back on this panel when we talk about.
Thank you, Birgit, because I was getting really fired
Sorry,
up.
I know we are all
And
very, feeling very strongly for the profession.
and by way of
And someone said
conclusion,
it earlier, we could have had a whole day of discussion on this topic, and I'm really sorry, but we need to, close it off because it's very late for our colleagues in some countries. And people might need to move to other meetings. So
really
thank you all
appreciate
for the
that. And thank you
facilitators, for
everyone
everybody who contributed.
for
The
that
next
wisdom.
module is on strategy and strategic planning. I will send a follow-up email in the coming days so that you can access the material, and then see you early February. Take care. Bye-bye.
Thanks,
Thanks,
Birgit.
everyone.
Bye.
Bye.
Thank you. Bye.
Bye.